Sarah preferred the night shift. Fewer people, fewer questions, fewer explanations. But when that patient saw her Army Ranger tattoo, she knew she couldn't hide her past anymore. And that past would now shock everyone at the hospital. Welcome to Daily Soldier Stories. Before we begin this powerful story, tell us in the comments which city you're watching from today. And if you believe military stories like this need to be heard, hit that subscribe button and help us keep these stories alive. It was 11:30 p.m. in the 6th floor ICU at Grady Memorial Hospital in Atlanta, Georgia. Fluorescent lights were dimmed, monitors softly beeping, with occasional footsteps echoing through the hallways. This was the perfect atmosphere for Elena Rodriguez's preferred working environment. Elena was 32 years old, a night shift registered nurse for the past 2 years. She always arrived at 10:50 p.m., exactly 10 minutes early. She always wore the same navy blue scrubs, her dark hair pulled back in a tight bun with minimal makeup. Professional, efficient, almost invisible. Other nurses knew her as reliable and competent, but distant. She never joined the post-shift breakfast gatherings at the nearby diner, never shared personal stories during break room conversations. She just performed her duties with quiet precision, then disappeared until the next shift. Elena's solid, but she's mysterious, day shift charge nurse Amanda would tell others. Never calls in sick, handles code blues like a pro, but never talks about her life outside work. The truth was, Elena preferred anonymity. Fewer personal questions meant fewer uncomfortable explanations about her past. At 32, she'd learned that some stories were better left buried. Tonight, Elena was responsible for 7 ICU patients. Mrs. Washington, post-cardiac surgery, Mr. Kim, motorcycle accident recovery, Staff Sergeant James Wilson, a 28-year-old Army veteran with severe burns from an Afghanistan IED blast. Each required different levels of intensive care, but all needed constant vigilance. Elena moved between rooms with practiced efficiency, checking ventilator settings, adjusting pain medication drips, monitoring neurological responses, updating electronic charts. She spoke softly with conscious patients and maintained professional distance with anxious families. "How's your pain level tonight, Sergeant Wilson?" Elena asked, checking the young veteran's IV medications. "Manageable. You military?" Wilson asked, studying her calm demeanor under pressure. Elena paused briefly. "No, just here to take care of you." Wilson nodded, but his eyes suggested he wasn't convinced. Something about Elena's bearing, her tactical awareness of the room layout, reminded him of soldiers he'd served with. Elena completed her rounds and returned to the nurses' station. It was a quiet night so far, which she preferred. Less chaos meant less chance of unwanted attention, fewer moments when her training might break through her carefully maintained civilian facade. But sometimes, the past refuses to stay buried in personnel files. 2:45 a.m. Elena was reviewing patient charts when an alarm sounded from room 612. Mr. Thompson, a 65-year-old diabetic, was showing signs of severe distress. Elena immediately rushed to the room and found the patient experiencing an acute cardiac episode. Heart rate irregular, blood pressure dropping rapidly, patient losing consciousness. "Code Blue, room 612, Elena called into the communication system, then immediately began advanced life support protocol. Within 3 minutes, the code team arrived. Dr. Jennifer Park, attending cardiologist, 2 other nurses, and a respiratory therapist. But Elena had already established IV access, administered emergency medications, and positioned the patient for optimal airway management. "Outstanding response time, Elena," Dr. Park said, taking the lead. "How did you assess and stabilize so quickly?" "Standard ICU protocol," Elena replied simply. But Dr. Park noticed something others missed. Elena's movements weren't just efficient, they were tactical. She'd positioned herself with clear sightlines to the door, maintained awareness of all equipment locations, and worked with precision, suggesting extensive emergency training beyond nursing school. Mr. Thompson stabilized within 15 minutes. Crisis averted, team dispersed, normal ICU rhythm resumed. "Elena," Dr. Park approached her at the central monitoring station. "That was exceptional clinical judgment under pressure." "Just doing my job." Your emergency management skills are remarkable. Prior experience, paramedic, flight nurse. Elena felt familiar anxiety creeping in. Grady University nursing program, did my clinical rotations here. Any additional trauma training? Your assessment was incredibly fast. No, Elena lied smoothly, just ICU experience. Dr. Park seemed satisfied and returned to other patients, but a seed of professional curiosity had been planted. Elena returned to her duties, but noticed increased attention from colleagues. Her emergency response had been too smooth, too military precise. People were starting to notice things she'd worked to keep hidden. The following week, Elena was assigned to a new patient, Captain Marcus Davis, 31, Army Special Forces, multiple gunshot wounds from a Somalia operation, extensive surgery, long recovery ahead, classified circumstances. Elena approached his room cautiously. Military patients, especially special operations, sometimes recognized something in her bearing and asked uncomfortable questions she preferred not to answer. Good evening, Captain Davis. I'm Elena, your primary night nurse. Davis studied her face carefully, noting her scan of the room before entering and her positioning near the exit. You serve? No, I'm a civilian nurse. Davis kept watching her movements, something familiar about her confidence, her calm in a high-stress environment, her tactical awareness. Combat medic background? Davis pressed gently. I don't know what you mean, Elena said, checking his post-surgical dressings. Davis noticed something as Elena reached across the bed to adjust the IV pump, a small tattoo on her left forearm, partially hidden by her scrub sleeve, a distinctive tab-shaped design with paratrooper wings and a star. Army Ranger tab. Davis's eyes widened significantly. Holy shit. You're a Ranger. Elena's hand instinctively moved to cover the tattoo. I need to check your pain management protocol. Wait, seriously? You're Army Ranger? Female Ranger? Elena looked at the Special Forces officer and saw recognition and respect in his eyes. She knew denial would be pointless with someone from that community. Several years ago. Which battalion? When did you deploy? Elena hesitated. 2 years of careful anonymity, and now the truth was emerging because of a careless moment reaching across a patient bed. 3rd Battalion, 75th Ranger Regiment, Afghanistan, 2018 to 2020. Davis stared. Female Ranger in combat operations. You were part of that pilot program. Officially, there was no pilot program. Officially, I was never there. Davis understood completely. Special operations often involved personnel whose existence wasn't acknowledged in public records. That explains your composure during medical emergencies. 68W training? Elena nodded slowly. Combat medic specialist. Did 3 deployments before Ranger selection. And now you're saving lives here instead of there. Now I'm here, Davis smiled with genuine respect. That's incredible. But why hide it? Elena pulled a chair beside his bed. For the first time in 2 years, someone knew her complete truth. Part of her felt overwhelming relief. Because people treat you differently when they know. They expect you to be someone you're not anymore. But you were different. You're a warrior. I was a warrior. Now I'm a nurse. I help people heal, not accomplish other missions. Davis studied her expression. What happened? Why did you transition out? Elena was quiet for a long moment. That's a conversation for another shift. Davis couldn't keep the secret entirely. Within days, word spread through the military veteran network. By the following week, hospital staff were hearing whispered rumors about Elena's extraordinary background. I heard she's former special operations, Amanda whispered to another charge nurse. Army Ranger or something like that, someone added quietly. That explains her intensity during emergencies. Elena noticed subtle changes in the workplace atmosphere. Colleagues were observing her differently, conversations pausing when she entered break areas. Exactly the unwanted attention she'd worked to avoid. Dr. Park approached her during a mid-shift break. Elena, I've been hearing interesting information about your military background. Elena felt cornered. What kind of information? Special Operations Service, Ranger qualification. Is this accurate? Elena considered maintaining her cover story, but Davis had already confirmed details to several people. Yes. Why didn't you mention this during our hiring process? Because it wasn't relevant to ICU nursing. Extensive combat medical training isn't relevant to critical care. Elena struggled with her response. I wanted a fresh start, to be evaluated as a nurse, not as a former soldier. Dr. Park nodded with understanding. I can respect that perspective, but your experience could be incredibly valuable here. We treat many veteran patients who might benefit from someone who truly understands their experiences. I prefer to keep professional duties and personal history separate. That's entirely your choice, but please know that your service is deeply respected here. Elena appreciated the sentiment, but worried about broader implications. Once word spread beyond hospital walls, there would be no returning to comfortable anonymity. The following week, a local veterans organization learned about Elena through military communication networks. The VFW post commander called hospital administration, requesting an opportunity to recognize her service. We'd like to formally honor Nurse Rodriguez for her distinguished military service, the caller explained to the hospital CEO. Hospital administration was excited about positive community publicity. The CEO called Elena into the executive office. This is a wonderful recognition opportunity for our hospital, the CEO explained enthusiastically. Female Army Ranger, now serving as a critical care nurse. Perfect story for our community outreach initiatives. Elena felt genuine panic. I respectfully decline any publicity. It's excellent public relations, demonstrates our commitment to veteran health care. Please, I just want to perform my nursing duties. One brief interview. Local news station. Very professional, very brief. Elena reluctantly agreed, hoping to minimize public exposure. The news crew arrived Thursday afternoon. Reporter, camera operator, prepared questions about her unique transition from special operations to healthcare. What motivated you to pursue Ranger qualification? The reporter asked. Elena felt uncomfortable under the camera lights. I wanted to serve my country at the highest level possible. And now you're serving patients instead of country. How do those skills translate? Combat medical training applies directly to civilian trauma care. Military medics learn to work under extreme pressure, save lives in impossible circumstances. Hospital ICU requires the same skills, just a different operational environment. Can you provide specific examples? Elena described the recent cardiac emergency with Mr. Thompson, how military training enabled rapid assessment and intervention. The interview aired the following evening. A 7-minute feature segment about a local female veteran serving the community as a critical care nurse. The public response was immediate and overwhelming. The hospital switchboard was flooded with calls after the news story aired. Veteran patients specifically requested Elena as their primary nurse. Community members wanted to express gratitude. Multiple media outlets requested follow-up interviews and feature stories. Elena felt completely overwhelmed. This was precisely the public attention she'd worked desperately to avoid. But something unexpected began happening. Veteran patients responded dramatically differently to her care. Staff Sergeant Wilson, the burn victim, opened up about his PTSD for the first time since his injury. Knowing you understand combat operations makes it easier to discuss what happened over there. Captain Davis recovered faster than projected, motivated by having a fellow special operations veteran providing his care. You understand what we've been through. You know what it takes to come back. Other veteran patients throughout the hospital specifically requested Elena's assignment to their care team. They trusted someone who'd shared similar high-stakes experiences. Dr. Park noticed significantly improved clinical outcomes among veteran patients under Elena's direct care. Your military background is making a measurable difference in patient recovery rates. Elena began recognizing genuine value in her revealed identity, not for publicity purposes, but for enhanced patient care and recovery. Maybe hiding my background wasn't helping anyone, she admitted to Captain Davis during one of his final ICU nights. Warriors adapt to new battlefields, Davis replied thoughtfully. Yours is just focused on healing now instead of other objectives. Hospital administration offered Elena a specialized position, Veterans Care Coordinator, working specifically with military patients, helping bridge the gap between military and civilian healthcare cultures. Your unique experience could benefit countless other veterans, Dr. Park explained. Veterans trust you in ways they simply cannot trust other medical professionals. Elena considered the offer carefully. I don't want to become a poster child for female veterans. You wouldn't be. You'd be a patient advocate for veterans who desperately need someone who truly understands their journey. Elena accepted the position with strict conditions. No additional media interviews without her explicit consent. Focus entirely on patient care and recovery, not publicity or recognition. Her new role allowed her to work exclusively with veterans struggling with various complex issues. Combat PTSD, traumatic brain injuries, adjustment disorders, substance abuse, survivor guilt. Tell me about Afghanistan, she'd say to patients suffering from trauma. I was there too, I understand. Having shared operational experience broke down psychological barriers that other medical professionals simply couldn't cross. Elena developed specialized protocols for veteran patient care, understanding military culture and communication styles, recognizing service-connected medical conditions, connecting patients with appropriate veteran resources. Hospital clinical outcomes for veteran patients improved dramatically under her comprehensive program. 6 months later, Elena was approached by the Emory University School of Nursing dean. Would you consider a teaching position, course development in trauma nursing, military to civilian healthcare transitions? Elena was surprised by the academic interest. I'm a practitioner, not an academic. You're exactly what we need. Students need real-world experience and practical knowledge, not just theoretical textbook information. Elena agreed to a guest lecture series. One semester became a permanent teaching appointment. Military medicine operates under completely different parameters, she explained to nursing students. You work with extremely limited resources, under intense pressure, with lives depending on immediate decisions. Students were fascinated by her first-hand experiences, practical combat medical knowledge that couldn't be acquired from standard nursing education. Elena found teaching deeply rewarding, passing on life-saving knowledge, training the next generation of trauma nurses with real combat experience. Why did you leave military service? A nursing student asked during an evening lecture. Elena paused. It was a question she'd avoided answering publicly since her transition. Because I realized I could serve my country through different means. The military gave me skills to save lives under fire. Now I use those same skills in civilian healthcare, helping people heal rather than accomplish other types of missions, the student pressed further. Do you miss military service? I miss the brotherhood, the clear sense of mission, but I've discovered a new mission here. Any regrets about your transition? Elena considered honestly. My only regret is hiding my background for so long. It took me 2 years to realize that my military experience could significantly help other people, even after leaving active duty. A year later, Elena received a completely unexpected visitor. A young woman in army dress uniform knocked on her hospital office door. Nurse Rodriguez? I'm 2nd Lieutenant Maria Santos. I begin Ranger Selection Course next month. Elena looked up, genuinely surprised. How can I help you, Lieutenant? I saw your television interview online. Your story inspired me to pursue special operations. I wanted to thank you personally. Elena felt a mixture of pride and professional concern. It's an extremely difficult path. I understand that. But seeing a successful female ranger transition to a meaningful civilian career gives me hope for my own future. What do you mean specifically? Knowing there's a fulfilling life after military service, that specialized skills transfer successfully, that service continues in different equally important forms. Elena realized her public story had an impact far beyond hospital walls. What's your long-term plan after the military? Medical school. I want to become a trauma surgeon. Your path from combat medic to critical care nurse showed me how medical training can evolve and expand." Elena smiled warmly. "It's an excellent path, challenging but deeply rewarding." Lieutenant Santos left feeling inspired and motivated. Elena sat in her office, reflecting on her unexpected journey from hidden veteran to mentor and role model. The phone rang immediately, another veteran patient requesting her specialized care. Elena answered professionally, ready to help. "Veteran Services, this is Elena. How can I assist you today?" Today, Elena leads the largest veteran healthcare program in Georgia. Grady Hospital has expanded her department significantly, hired additional specialized staff, and serves over 800 veteran patients annually. Elena no longer conceals her military service. She wears a small Ranger tab pin on her nursing uniform, a visible reminder of her unique journey and qualifications. Veteran patients see the pin immediately and know they're receiving care from someone who truly understands their experiences and challenges. "You really understand what we went through," veteran patients consistently tell her. "That understanding makes all the difference in recovery." Elena's comprehensive program has become a national model for other hospitals. She speaks regularly at medical conferences and trains healthcare professionals nationwide in veteran-specific patient care. "Military service doesn't end with discharge papers," she tells medical audiences. "It transforms and evolves. Your mission changes, but the fundamental commitment to service continues." Elena still works occasional night shifts by personal choice. She enjoys the quiet hours, uninterrupted time to focus on direct patient care without administrative distractions. During those peaceful night shifts, she reflects on her journey from hiding her military past to embracing it as an essential tool for helping others heal. Her Army Ranger tattoo is no longer hidden beneath long sleeves. It's a visible symbol of experience that makes her a superior nurse, better advocate, and more effective healer. Elena learned that running from your past prevents you from using it to help others. Her military service didn't end when she removed her uniform. It evolved into a new, equally important form of service. "Once a Ranger, always a Ranger," she tells veteran patients. "We just find new ways to continue serving." Elena Rodriguez's story isn't a hiding story. It's an evolution story. How military service transforms but never truly ends. How skills learned in combat operations can serve a healing mission in a civilian healthcare environment. That Army Ranger tattoo being accidentally seen changed everything forever. But Elena's response to unwanted exposure showed her true character. Instead of retreating further, she chose to embrace her identity as a powerful tool for helping others heal. Because authentic warriors don't stop serving when they remove their uniform. They discover new battlefields where their specialized skills can make a meaningful difference. Elena could have continued hiding, maintained comfortable anonymity, and avoided the complications of a revealed military identity. Instead, she chose vulnerability and trusted her story to help others recover and heal. The result? A hospital community was completely transformed. Veteran patients received dramatically better care. The next generation of medical professionals learned from real combat experience. Young women were inspired to pursue military service and healthcare careers. Sometimes the most important missions aren't fought with weapons. They're fought with compassion, medical knowledge, and a willingness to use your past experiences to serve others' futures. Elena Rodriguez demonstrates that heroes come in many different forms. Some wear military uniforms in combat zones. Some wear nursing scrubs in hospital ICUs. Some serve by healing rather than fighting, by building rather than breaking. Have you ever hidden a part of yourself that could significantly help others? Someone whose military experience could benefit a civilian mission. Someone who discovered a new way to serve after a military transition. As Daily Soldier Stories, we'll continue sharing these military narratives. Because every veteran has a story worth telling. Every service member has wisdom worth sharing. Every career transition has lessons worth learning. If this story touched you, subscribe and share. And remember, heroes might be caring for you in hospitals, teaching your children, and serving your communities. Their service continues in forms you might not immediately recognize, Because sometimes the most important discovery isn't someone's past military service. It's how they use that military experience to help others heal and recover today.